Welcome to This Explainer. I'm a senior pelvic floor physiotherapist at OVA Women's Health, and today we're unpacking a really misunderstood condition, pudendal neuralgia. We're going to look at exactly what it is, why it happens, and most importantly, how evidence-based physiotherapy can actually bring you relief. But before we get into the mechanics, I just want to pause for a second. Take a deep breath and really hear this. Your pelvic pain is real. It is absolutely not in your head. Look, you've probably spent years feeling frustrated. Maybe you've even been told this pain is just, part of being a woman, or worse, that you're just imagining it. Well, I'm here to tell you that your pain is a physiological reality. Your experience is 100% valid, and you deserve to be taken seriously. Okay, so let's dive right in. What exactly is the pudendal nerve? Well, think of it like a major communication cable running deep through your pelvis. It's incredibly essential. This nerve is responsible for the sensation and motor control in your genitals, your perineum, and the rectal area. Plus, it supports vital, everyday things we don't even think about much, like bladder and bowel control and sexual function. Honestly, it does a whole lot of heavy lifting just to keep your pelvis stable.
So, what happens when this crucial nerve is compromised? Well, pudendal neuralgia develops when this specific nerve becomes irritated. It basically gets compressed or way too sensitized by the tissues surrounding it. And because it plays such a massive interconnected role down there, this irritation leads to some really significant pain. It causes a profound disruption to your everyday life. And the really crucial point here is recognizing how this actually feels in your body. You might be experiencing this sharp, stabbing, almost electric shock kind of pain. Or maybe it's this deeply distressing burning or tingling sensation. For a lot of women, it makes sexual activity incredibly painful. You might also notice urinary or bowel dysfunction, or even this weird mix of numbness 1 minute and extreme hypersensitivity the next. If you're nodding along to these symptoms right now, please know that I truly see you. I work with patients literally every single week who describe these exact same feelings.
Now, here's something really fascinating, and it's a huge clinical indicator for us. We look for a very specific contrast. Sitting pain is actually one of our absolute strongest diagnostic clues for pudendal nerve irritation. So many women notice this intense, increasing burning pain the exact second they sit down, but then they often feel immediate relief when they stand up or lie down. That mechanical response is a massive clue for us. At this point, you're probably wondering, how did this even start? Well, the potential causes and triggers actually vary widely, and you don't necessarily need to have experienced some major physical trauma for this to develop. Often I see it start from something as simple as just sitting for long hours at a desk job. Other things like high-impact exercise, childbirth, or a past pelvic surgery can also act as triggers. Even dealing with chronic constipation, or just holding deep chronic muscle tension in your pelvis over a long period of time can eventually lead to that nerve getting compressed.
Okay, stay with me here because this next part matters most. We've talked about the reality of your pain, and we've validated exactly what's happening inside your body. But now, let's shift gears. It's time to look at the exact blueprint for getting you relief.
Here is your path forward. This is a structured, entirely evidence-based physiotherapy journey. It's a realistic, actually achievable path to feeling better. It breaks down into 4 key steps: pelvic floor muscle relaxation, biofeedback, neurogliding, and some very specific lifestyle modifications. Healing is absolutely a step-by-step process, but I promise you, it works.
Let's look at step 1, muscle relaxation. The reality is, most individuals dealing with pudendal nerve irritation have really tight, overactive, or guarded pelvic floor muscles. They're often clenching without even realizing it. So we need to reduce that mechanical compression on the nerve. We do this through very gentle manual release, targeted myofascial techniques, and specific breathing strategies. The whole goal here is just to calm your nervous system down and softly release that physical pressure.
Moving on to steps 2 and 3, which focus on biofeedback and neurogliding. Biofeedback is amazing because it helps you consciously understand and actually relax those pelvic floor muscles effectively. Then there's neurogliding. Sometimes we call it nerve flossing. This improves the nerve's movement and boosts blood flow to the area. And we do this incredibly carefully to restore pain-free movement patterns without ever provoking or stressing out your nervous system. Which brings us to a question I hear practically every day in the clinic. Is this permanent? I want to address that deep fear right now. The answer is no. It is absolutely not permanent. Getting targeted early intervention significantly improves your recovery outcomes. With the right clinical support, your body is highly, highly capable of healing. So, how do we actually put all of this into practice? Well, this is where OVA Women's Health comes in. We are a multidisciplinary specialist clinic located in Burnaby, BC, and we deeply understand complex pelvic nerve pain. Think of us as a safe haven, a place designed specifically for those complex conditions that general physiotherapy clinics, unfortunately, sometimes miss. Our approach here is entirely different. We have advanced, specialized training, specifically in complex nerve pain. Our care is gentle, and it's tailored completely to your unique pain triggers. We integrate biofeedback and manual therapy within a strictly trauma-informed, incredibly supportive environment. And really importantly, we don't just look at the pelvis in isolation. We perform a whole body pelvic health assessment to ensure that your healing is complete and, more importantly, lasting.
Look, you have been patient long enough. I know pelvic pain is incredibly isolating, and honestly, it can just slowly drain your hope. But specialist help exists. At OVA Women's Health, you will never have to navigate this complex journey alone again. We know how to listen to you, and we know exactly how to treat this.
Reclaiming your pelvic health really just starts with a single step. You can easily book an unhurried, totally confidential consultation with us to get started. You deserve to feel better. You deserve to live without pain dictating your everyday choices. So I'll leave you with this. What would your life actually look like if sitting down just didn't hurt anymore?